2018 has been quite a year. There have been challenges, to be sure, but as I look back, I see so many examples of how we have stepped up to those challenges. I'm especially proud of our achievements in improving patient safety and quality care. The A grade that Central Maine Medical Center earned from the Leapfrog Group and the top rural hospital status awarded to Bridgeton Hospital and Rumford Hospital are the result of your efforts and exceptional teamwork. In 2018, we met high standards of excellence system-wide, from improvements to our facilities and equipment to investments in our most important resource, you.
There are about 3,500 people who work at CMH, and we're always looking for more people to join the team. That's why this year I'm most proud of the progress we've made in recruitment and supporting the people who work here today. Applicants are having a better experience and jobs are getting filled more quickly. We've provided more learning opportunities for our leaders to continue to grow in their abilities. We implemented a new compensation plan that increased pay for team members across the system. And we are committed to working with team members every day to help create a better working environment.
The Results Management Office, or RMO, helps manage big enterprise-wide projects. We ask which processes or workflows need improving and then work with design teams to figure out how to do it. There are many process improvements happening, and I'm confident our teams will keep finding innovative ways to do things better. I also oversee our long-term care facilities, and I'm so grateful for the staff and leadership at Bolster Heights in Auburn and Rumford Community Home in Rumford. They work with great purpose on behalf of our most senior and fragile residents.
In 2018, we put forward initiatives and partnerships to increase access to healthcare for our communities and improve quality and experience for our patients. We kicked off the year by bringing CMMC's first MRI within the hospital walls. In July, we partnered with Shields Healthcare Group to offer mobile MRI to Bridgeton and Rumford hospitals to support their imaging services. We can be especially proud of all the improvements made by our medical teams. We have been fortunate to recruit physician leaders across a number of specialties. We are rebuilding our surgical program with our new chief of surgery and expect tremendous growth in the future from that initiative. We also hired a new medical director for trauma in a joint appointment with Massachusetts General Hospital. That unique partnership will bring more training for our physicians and cutting-edge care for people in Maine. Without a doubt, the quality of our clinical team is top-notch.
I think the biggest thing for me was to watch this team mobilize around improving patient safety and quality of care. We've wiped out our central line infection rates and have dramatically reduced our C. diff rates through infection prevention initiatives such as hand hygiene, cleaning of equipment, and use of protocols. At the end of 2017, we solidified our nursing vision, philosophy, and strategic plan. This year, we put that plan into action, starting by laying the cornerstone, a shared governance model. Currently, 90 nursing members from across Central Maine Healthcare serve on our 6 councils. We've also expanded the vascular access team, improved our rate with IV access, added a transport team, and have implemented phase 1 of our CareAware communication system. All of these improvements, your individual and collective efforts as a team, have helped improve the care we provide to our patients and our community.
I'm grateful for being surrounded by talented colleagues committed to our mission and strategic plan. To grow in healthcare requires discipline and laser focus on the areas of business opportunity. The legal and risk management teams have played an integral part respectively in our business development and patient safety initiatives. As an organization, we generate thousands of contracts, manage claims, work with internal stakeholders to learn from experiences, and strive every day for clinical excellence.
Central Maine Healthcare's footprint and visibility have grown a lot this year. Our expansion plans and our commitment to the most convenient, high quality, low cost, and outstanding patient experiences like no other in Maine. This summer, we opened Topsom Care Center, a community care center in partnership with New England Cancer Specialists, Plastic and Hand, Shields Healthcare Group, and Quest Diagnostics, plus primary care providers and specialists from the Central Maine Specialty Care, including vascular, endocrinology, cardiology, and urology. We also launched Maine Urgent Care at the Topsom Care Center, and plan to open another in the Lewiston-Auburn area in 2019. This year, we've seen a huge opportunity for improvement in communications at CMH. Externally, we want to share our success in a way that creates excitement and respect for the great work that we do. Internally, we want to keep working on our infrastructure and processes to do a better job sharing all that we're doing with one another.
Rumford Hospital had a great year, entirely due to the staff that works here. You're all so committed to the quality, excellence, and the safe patient care you provide every day. The Rumford staff is also a very giving staff, as you may see them out in the community, at health fairs, offering blood pressure checks at the Culture of Compassion, or giving free flu shots at the Pumpkin Fest. They may even be feeding hikers on the Appalachian Trail. During this holiday season, the staff here even raised over $1,500 for local shelters in the River Valley. I'm so proud and grateful to the staff this year as we celebrated being named one of the top rural hospitals in the country. In addition to that, we once again scored above the benchmark in all categories in the ARC Hospital Survey on patient safety. I look forward to our opportunities in 2019, and I thank you all for everything that you've done for our patients and the community.
This year, Bridgeton Hospital continued to provide outstanding care to our patients. And for the third year in a row, Leapfrog Group honored Bridgeton as one of the top rural hospitals in the country. It hasn't been easy, and we have a lot of work ahead of us to rebuild community trust. But we will, because our staff stays focused on what's important, and that's patient care. We have an amazing team at Bridgeton Hospital, and I am grateful not only for their commitment to our patients, but to one another.
Central Maine Medical Center received a number of recognitions in 2018, and I'd like to share a few of them. We were named one of the nation's 50 top cardiovascular hospitals by IBM Watson Health. This is the first year that CMMC, with its Central Maine Heart and Vascular Institute, has been recognized, and is the only hospital in Maine to receive the honor. We were also designated an Aetna Institute of Quality Cardiac Care Facility for comprehensive heart and vascular treatment. CMMC was also awarded the Chest Pain Center accreditation with primary PCI by the American College of Cardiology and was honored for high-quality stroke care, earning certification from the Joint Commission. The hospital had among the top positive patient outcomes in the country, and the reviewers called CMMC's stroke care team among the leading programs in the nation. The Joint Commission also certified CMMC for excellence in an array of orthopedic services, such as total hip replacement, total knee replacement, total shoulder replacement, and hip fracture. We got a lot of kudos in 2018, and it's because of the tireless work of everyone here.
I'm grateful for the commitment and the grit of the entire organization. Your resilience and tenacity has been on full display. And as the year comes to a close, I want to celebrate everyone on our team, our board, and the support they give us to work on their behalf in service to our communities. The physician and nurse leaders who have stepped up to build our programs, to improve quality, and to help us integrate across our entire health system. Our staff, and I mean every single person who allows us to provide quality patient care, whether you're in the operating room, on the phone, at the bedside, or behind the scenes, it takes a team. As Central Maine Healthcare continues to grow and improve, let's never forget our fundamental purpose: to help people and communities to thrive.